This is pediatric integumentary skin, okay? This is a quick review, and we'll go over some of the pediatric specific disorders you may see more often. Again, you know you have your epidermis, your dermis, and your hypodermis, followed by muscles, okay? You know our skin is the first line of protection, okay? All right, contact dermatitis. This is something that can occur when your body comes in contact with something, okay? Whether it's a new soap, a new medication, and we ask about laundry detergents, perfumes, lotions, makeups, all of those types of things, okay? So you need to have them recall some of the new things that could have been. It could be jewelry, if you've ever reacted like to a ring, okay? Get redness around your watch, dryness, that's like a contact dermatitis, okay? You can get it from poison ivy as well, okay? Wherever it touches you, it leaves these red, bumpy, irritant marks, okay? Obviously, risk factor is exposure to the item, whatever it may be, okay? Redness, itching, swelling could be vesicles. They could ooze, okay? So we want to avoid contact with known irritants, okay? What can we do over the counter to prevent this itching, redness? What could you tell a parent to use over the counter? Antihistamine.
Like the Benadryl cream.
Benadryl cream, absolutely. And then if they needed something oral, okay, or topical, that's prescription to help with the itching or the inflammation.
For inflammation and for inflammation.
To reduce inflammation, steroid, okay? So prednisone, triamcinolone cream, if you've ever been given a steroid cream, okay? And then when would we give antibiotics for a contact dermatitis?
This is like some type of bacterial.
Yeah, a secondary bacterial infection. If it's starting to look like impetigo, you know, more pus, drainage, a lot more redness than it should, okay? This is usually self-limiting, okay? Or if you remove the irritant, okay? You can see this line for the contact dermatitis with poison ivy, and it's wherever the bush or the leaf or whatever touched your arm or leg or wherever, okay? So the contact of it, okay? All right, again, we have to watch for anaphylaxis as well, and then we treat it like anaphylaxis if that does happen, okay? All right, oh my goodness, what are systemic steroids? What does that mean? If I'm giving a systemic steroid, how is it going to be absorbed? IM, sub-Q, IV, PO, okay, systemically. If it's just topical, okay, it's not systemic, okay, if I'm just putting it in a small location, okay. If it is covering a large area, okay, such as the face or the genitals, okay, or a very specific area, the face, we worry about anaphylaxis, right? So they may need oral steroids, okay. All right. And then topical includes all the things that we've talked about, you know, calamine lotion, Benadryl cream, triamcinolone, okay, prednisone cream, all of those types of things, okay? And again, try to find out what the actual trigger is. If you don't know, sometimes these kids might have to be allergy tested. If it's every time they go outside, they roll around in the grass, or they're outside by the oak tree, okay? So sometimes it could be related to that, okay? All right, and this has, I think, some more pictures of a contact dermatitis. That's the poison ivy again. So the scratching is what can cause a secondary bacterial infection with the nails because we have staph under our nails, okay? Again, for the poison ivy, they can self-spread, okay? So if they're itching one area and they touch another, just like with impetigo, okay? For the poison ivy, Benadryl, steroids, okay? Benadryl, this is a big thing in kids. It can cause a paradoxical effect, okay? What does that mean? the opposite. So you or I, Benadryl may make us sleepy. For children, it may make them excitable, okay? So they have this, what we call paradoxical reaction, the opposite of what an adult has, okay? So that's something to warn parents. They may be sleepy, but some children have that paradoxical reaction, okay? All right, diaper rash or contact dermatitis. Sometimes this can happen by diaper use. So parents may have to trial and error different diapers that can be irritating. Again, take and change the wet diapers very fast, okay? Otherwise, it can lead to irritation of the skin, okay? Wearing diapers too long, being in daycare where they're not changing them or they don't know that they're wet, okay? Again, this increases the risk for candida, which is yeast, okay, or staph infections as a secondary infection, okay? Again, for diaper rash, cleaning the area, applying a zinc or a nystatin. Nystatin is specific for yeast, okay? Zinc is a barrier. Hydrocortisone is an anti-inflammatory. That's a steroid cream, okay? If you've ever used hydrocortisone. Okay. Up to 50% of kids will have diaper rash at some point. Okay. Proper hygiene, trying to let them even run bare butt if they can. Okay. If they're not mobile, putting them on a towel, letting them air out. Okay. Okay. Diaper need is not having enough diapers for the child due to socioeconomic factors. So what can that lead to? If you don't have enough diapers, what are you going to do? Yeah, you're not going to change them, but probably twice a day, okay? That's going to lead to skin breakdown, obviously, okay? I mean, diapers can be expensive. Each year, parents spend about $1,000 in diapers, okay? And that's probably the lower end diapers, okay? So asking how often they actually change the kid's diaper, okay? All right, seborrheic dermatitis is something that kids can have, or even like cradle cap. It looks like crusties, scabies almost on the scalp, okay? A lot of times this is due to this sebaceous gland, and then it can set the area and stage for a fungal infection, okay? It's usually self-limiting, okay? 3 months of age is usually when you start to see it. It can be yellow, crusty, brownish lesions on the top of the scalp, okay? Can also have it around the skin of the eyes, the ears, the armpits, okay? It's not painful. It doesn't really itch. It might itch tiny bit, but more just because the skin is dry, okay? Let's see. Conservative treatment usually includes a mild shampoo, okay? You can use different things to loosen the little scales, okay? And then brush them out with a comb. I know there's been TikToks and videos of how to get rid of cradle cap, if you want to watch that, if you think that's something that is informative, okay? Some cases, if they're not getting better, because this can be due to fungal, we will use ketoconazole shampoo, which is an antifungal shampoo, okay? Ketoconazole, remember azoles are fungals, okay? All right, again, simple skin care, head care, and a lot of times they will grow out of this, okay? Sometimes you do have it later in life. All right, atopic dermatitis, also known as eczema, okay? This is a chronic disorder of inflammation of the skin, okay? It's usually due to a dysfunction in that epidermal layer that leads to stimulation of the immune system and cytokines that cause inflammation and overproduction of the keratinocytes and resulting in hyperplasia of the epidermis, okay? So it just keeps on having new skin cells, okay? The most common type of dermatitis that is diagnosed between birth and 2 years, okay? redness, itching, skin flaking, inflammation, okay? Usually this is seen, the elbows, the back of the knees, the wrists, the forearms, okay? Have you guys seen this in clinical or in the world, or family members who may have it? Okay. All right. So a lot of the treatment includes hydration of the skin, Aquaphor, topical steroids, okay? Tacrolimus is an ointment that is steroid free, okay? Remember when I told you these are the kids that feel like prednisone or cortisone is like crack to them because it'll clear up their skin and they're like, oh my God, I need it again, I need it again, I need it again. So they're on steroids all the time because it just clears it so well, okay? But then that can also thin the skin too much, okay? I will tell you this in case you ever hear it in clinical practice or see it on the NCLEX. This is one of the things that we will recommend sometimes, doing a bleach bath. And when we say a bleach bath, it is literally a quarter cup, this much, okay, into a medium to full bathtub, okay? And it's supposed to help with that turnover of the skin cells, okay? And they can soak in that for like 5 minutes, a couple times a week, not every day. Okay, so if you do see that, that is an actual regimen, okay? But keeping it moist. So big thing for the NCLEX and covered, so it might be like lathering them up with their steroid cream or lathering up after a bath with Aquaphor and then putting their PJs on to kind of keep that moisture in, okay? You might not want to bathe these kids every single day, okay? And that's okay. All right, med reactions, okay? Med reactions, this is a drug, xanthum, okay? Xanthum is a word that we use for maculopapular rash, okay? Sometimes these can look measles-like. What do you think the most common drug to cause kids a rash is? What's the most common drug prescribed to kids? Which antibiotic? You get some, you get some, you get some. Amoxicillin. Mm-hmm. So a lot of times they will have a little red rash. Mm-hmm. Okay. Macular papular rash. Okay. Some people think that there's a genetic predisposition if they're going to get this rash or not. Okay. They can actually do allergy testing for penicillin, a true penicillin allergy. Okay. Let me see here. All right. Again, medication reaction. Again, there's another picture for you. So again, a lot of times we will stop the medication. Okay. Make sure it's due to the medication and not the virus though. So sometimes we have to look at the whole picture. Okay. Symptom control with antihistamines and steroids again. Okay. Zyrtec or cetirizine is often used for kids. All right. And again, this is usually self-limited and will resolve on its own. Okay. Let's see. Animal contact or insect bites, stings, anything like that. Okay. Mosquitoes, we know, fleas, ticks, they can leave little red marks on the skin as well. Bed bugs. Okay. Apparently, they think that having O-type blood puts you at higher risk for getting bug bites. Okay. All right. Again, we know mosquitoes, okay. Tick bites can lead to Lyme disease, okay, and Rocky Mountain spotted fever, okay. So for Lyme disease, this is called a target or bullseye rash. That is something that tests like to pull out because it is so specific, okay, with the central clearing. So you'll have a red mark, then some whiteness, then some erythema on the outside. So target or bullseye. Okay. Mites or scabies, remember that they burrow under the skin and that can cause like little abrasions from the itching, okay, usually around the wrist and exposed skin areas. okay? Chiggers are also found in wooded areas, okay? Usually you don't feel their bite, but it's usually can be in the lower legs, and it has a ton of itching, okay? Usually when you're walking in the woods or something like that, okay? There's some different rashes for you there, okay? Wasp sting can swell up, okay? Some people can have an allergic reaction that actually goes anaphylactic, okay? Spider bites is specific. They usually have 2 puncture wounds, okay, next to each other, okay, with some localized redness, okay. Scorpion bites can have some neurological symptoms, okay, with muscle twitches, and can actually cause arrhythmias. So scorpion bites can actually be dangerous, okay. Rare here, higher in like Arizona and things like that, okay. All right. Insect bites and stings. Again, ibuprofen, Tylenol, calm down the pain. Okay. Doxycycline if they're looking like they're infected or potential Lyme disease. Antibiotics like amoxicillin if it looks like a cellulitis. Epinephrine if they're having an anaphylactic reaction. Okay. We don't have to do any labs or diagnostic testing, okay? There is testing for Lyme disease because Lyme disease can have some chronic things in life, okay? So there is testing that can be done for Lyme disease or Lyme exposure, okay? Again, calamine lotion, things like that, okay? All right, I'm gonna do a quick farm thing. Lyme disease is usually treated in adults with doxycycline. Does anybody remember why we don't give kids doxycycline? And we will give them amoxicillin instead. So it can affect bones and teeth, okay? So it can cause permanent discoloration to their teeth and can affect their bones. So we're not going to give doxy usually until over the age of 8 or so, okay? And then amoxicillin if we do believe it's a true tick bite and form of Lyme disease, okay? So again, prevention, wearing long clothes if you're going outside, prevent scratching, okay? Pat it, use gloves, all of those things, okay? All right, animal bites, dog bites, cat bites. Which one do you think gets infected more so? Dog bites or cat bites? Actually, surprisingly, no. Cats, okay? Cats have sharper, deeper teeth, and it usually punctures deeper, potentially all the way to the bone. So about 80% of cat bites are going to become infected, and about 20% of dog bites are going to become infected, okay? Cat bites are very high risk because of the deep puncture. Okay, you can get osteomyelitis, which is a bone infection. So they do need antibiotics, okay? All right. Dog bites are more typical to have lacerations, especially larger dogs, okay? Need plastic surgery or repair, all of those things, okay? They also need to make sure what vaccine is up to date. Tetanus, okay? Tetanus lives in the dirt. These animals eat things from the dirt, okay? All right. Again, cat bites are usually more painful, like I said, because they go deeper, okay? Tetanus, we already talked about. Remember 5 years, okay? If it's over 5 years, they need to be updated, okay? A lot of places have an animal bite policy, okay, where you have to report it to animal control. They will quarantine the dog because you got to think about rabies also, okay? Even though it's usually lower incidence, but what if they're not vaccinated? What if they ate a bat? What if they ate something else that could have had rabies, okay? Keeping the area clean and dry. Usually having a 48-hour recheck after the initial evaluation to make sure it's getting better and not worse, because some of these do have to go to surgery, okay? They'll go in and explore the tissue, explore the tendon, okay? All right, human bites, very common in children, okay? Especially young children at daycare, okay? However, we have staph and strep in our mouth, okay? So we can infect that into the skin, causing infection, okay? All right. Most of these heal fine with clean, washing it off, antibiotic ointment, but some can get infected, okay? Again, we worry about hepatitis B, C, HIV, herpes, all of those, okay? A lot of times if it's a deep wound and it drew blood, we will still cover them with antibiotics, okay? Trying to help them socialize and understand to use their words or use their feelings or cue cards so they're not getting aggressive and lashing out and biting, okay? All right, a few last disorders of the skin, okay? Psoriasis, okay, is usually autoimmune, but it is an inflammatory disorder, okay? Inflammation and an inflammatory disorder. And the big thing to remember with this one is it's plaques, okay? Plaques on the skin. Big fancy word for you. This is Goutte psoriasis, which is just like pinpoint. Doesn't fit the normal scenario, but normal psoriasis has well demarcated, big word, plaques, which means I can pretty much draw an active circle. They're pretty circumscribed, okay? They're pretty specific. You can see, okay, there's one, I can see that. It's not like hives where they're all running together, okay? You guys can see that, okay? And it looks like you could almost take a skin biopsy and peel one of those off if you wanted to cut it off, okay? So they look stuck on, okay? So psoriasis, like I said, immune system leading to inflammation of the skin, okay? Treatment usually occurs including multiple treatments, topicals, orals, ultraviolet therapy, okay, like blue light therapy, topical steroids, okay? There's also other meds, anti-immune drugs such as methotrexate or other meds that help slow down the immune system, okay? All right, so that's some things to remember here, okay? Infantile acne, we remember this is normal, okay? Due to the little sebum, okay? Try not to tell the parents to pick at it. It will go away, okay? Regular acne, okay? We know that can cause a lot of stress, okay? Risk factors include their diet these days, their sugar intake, lack of water intake, stress, anxiety, anger, all of that, PCOS, all of these things, okay? Occurs throughout childhood and adolescence, okay? Again, these can be whiteheads, blackheads, all of those things, okay? Remember, in older adolescents, we can use things like birth control to help with it because the estrogen can clear your skin. Spironolactone, I think I've mentioned this before, it kind of blocks the testosterone. Spironolactone is what class of drug? Diuretic, potassium sparing diuretic, but it sits on the testosterone and it blocks it, okay? Therefore, it can also cause gynecomastia in guys, okay? Breast tissue in guys, okay? But it can be used for acne. It takes months to work, so it's frustrating, but it can be used, okay? Other things we learned, Accutane, which is the isotretinoin, okay? Which is pretty much very high dose vitamin A. Remember, they have to sign their life away and be on 2 forms of birth control, okay? All right, and remember, you cannot get pregnant on that medication because of all the birth defects that it can cause, okay? We have a whole slide devoted to that, okay? It's prescribed for severe acne that are not responsive to all those other treatments, birth control, spironolactone, doxycycline, which is an antibiotic because we try to hit it from multiple facets, okay? Again, they have to sign this thing, an iPledge program, 2 forms of birth control, 2 negative pregnancy tests, and monthly pregnancy tests, okay? And usually blood work every 3 months as well, okay? Because it looks at liver function and it can raise their cholesterol, so it looks at that. It can also cause suicide and depression, so if you have a question about that, you have to be monitoring for those things, okay? All right. It can cause bone pain and joint pain because it dries the kid out. Literally takes all the fluid out of the body. Okay, so their eyes are dry, their mouth is dry, so you might have education on that. Okay, their hair is super dry. All of those types of things, okay? All right, cellulitis, we've talked about cellulitis. You know that's infection of the skin, okay? Oral antibiotics, IV if it's worse. Vanco is a very common drug that if it's a super systemic infection, okay? Thermal injury, we've already talked about burns, okay? Friction burns, heat burns, electrical burns, radiation burns, okay? There's a whole lesson on burn injuries found in the lesson. Here is the pediatric rule of the 9s, okay? It's a little bit different, okay? I'm not gonna expect you to know this right now, but just know it's a little bit different. Thermal injury again, okay? What kind of nutrition are they gonna need for wound healing? Protein, okay? Good. All right, other miscellaneous disorders. I think we covered it all. Okay, there you guys go. You guys can take a 5 or 10 minute